Welcome to the Innovation Accelerator podcast, brought to you by Innovacer, the health cloud company. We're on a mission to connect and curate the world's healthcare information to make it accessible and useful. With Innovacer, everyone works in the service of patients like never before as one. Visit us online at innovacer.com.
Welcome back to the Innovation Accelerator podcast. I'm your host, Steve Ambrose. On today's show, our Chief Population Health Officer, Dr. Brian Silverstein, will be having an engaging conversation with Dr. Zev Neuwirth. Dr. Neuwirth serves as the Clinical Chief of Care Transformation and Strategic Services for Atrium Health. He has over a dozen years of experience in care redesign, quality improvement, and innovation. His efforts to improve and transform healthcare delivery have been featured in Newsweek, Forbes, Fast Company, WebMD, the Yale School of Management Journal, and in 2 Harvard case studies. In August 2017, Dr. Neuwirth launched a biweekly healthcare podcast entitled Creating a New Healthcare. In recent years, his podcast has been named as one of the most popular healthcare podcasts and was awarded Healthcare Podcast of the Year by HITMC. Most recently, Dr. Neuwirth has published a book, Reframing Healthcare, rated on Amazon as a #1 new release in the categories of healthcare administration and healthcare policy. And we're fortunate to have him on the show. I'll now hand it off to Dr. Silverstein and Dr. Neuwirth.
Thanks, Steve, for that gracious introduction. So excited to have a colleague and friend, Zev, with us. And what's really exciting about this is that I've known Zev for quite some time, so many years. I'm not sure exactly how many, but it was before he became famous with his podcast. And in fact, I remember several conversations that we had either at the Governance Institute or other meetings. And he was so excited about getting into administration more and making more of a difference in healthcare. So maybe why don't we start out with that, Zev? I'd love to know a little bit about how the podcast started.
Brian, great to see you again. And I don't remember how many. In fact, if I did remember, I wouldn't share with the audience how many years ago we first met. But, going back to the beginning of my career, as a touch point, as an internal medicine doctor, day in and day out for years, seeing patients in the hospital, in clinic, originally in New York City, and then in Boston, and really got to see healthcare from different sides, and felt like you were just articulating, felt that I needed to do more in terms of fundamentally transforming healthcare. I felt it wasn't enough to just try to make it better. And again, I think process improvement and quality improvement, which I spent many, many years focused on and still am involved in and engaged in, so critically important. And at the same time, I felt we really have to transform healthcare. And I think we're beginning to see more and more of the healthcare community as well as the public becoming aware of that, issues of systemic racism, disparities in care, the impact on our environment. Those are just a couple of the factors where I really began, or just even the consumerist movement, right? Began to see that we have to make some leaps. And that's what I sort of shifted my career from seeing patients to really this, I guess you can call it administration, but I think of as administrators and myself more in terms of change agents and helping to catalyze change for the better.
That's amazing that, you've taken this essentially this itch and passion that you've had and channeled it into something. Maybe if, before we go into greater depth on that, I'd love to understand like the first episode. And I think that first episode was probably back in 2017. Do you remember your first episode? What was that like?
It was probably one of the scariest things I've ever done. I actually, believe it or not, as you know, some of this work gets done. In fact, not some, most of this work of podcasting gets done in your off hours on weekends and evenings, because, I've got a day job. And so, I actually recorded the first podcast while we were away on vacation, and I woke up at some crazy hour of the morning. We were at the beach somewhere, and in August, like you said, in 2017, and I got into a small closet with pillows around me, not to wake up the family, and took out my mic and said, "Hi, this is Dr. Zev Neuwirth, and welcome to Creating New Healthcare." And that was the launch of it. Yeah, and now it's tomorrow. I'm going to post episode 135, and as you know, these are in-depth interviews with people around the country and around the world who are really transforming healthcare, making just incredible changes for the better.
It's so amazing that you've been able to have so many interesting guests. By the way, that's an amazing story with that first episode, and quite a visual too. I think a lot of people will relate to that they have a desire to do something, and you find a way, and even if that means on vacation.
And I think, Brian, but I think that's really a great message too. It's like I said, I have a day job, so this had to happen in the off hours. I was just actually speaking to a colleague and lamenting. They said, "Well, how was your weekend?" And I said, "Busy," because basically at least one of the 2 days in the weekend, I'm working on the podcast, and that's it's important work, and it has to happen. And so, actually, I could relate a story to you if you don't mind. It was actually a Saturday morning, probably a month ago, and my wife and I were early morning making breakfast together, cleaning up the kitchen together, and my daughter, 17-year-old daughter, was in the room. And we, once in a while, my wife and I joke about retiring, and I'm a workaholic, as I'm sure you are, and we joke about it. And my daughter overheard us speaking, and she wasn't aware that this was just a little banter. We go back and forth every few months or whatever, and she turned to me. She said, "Daddy, you can't retire." And I thought, she's going to say something like, "You can't retire because you've got to, keep on giving me money, and pay for college and all that sort of stuff." But she didn't. She actually looked directly at me and she said, you went into this. You started the podcast. You've been interviewing people. You wrote the book on reframing healthcare. What you do with that and what you're doing in your day job. You're supposed to be fixing healthcare. And I said, "Yeah." And she said, "And healthcare is still broken, so you can't retire." And she was dead serious. I mean, that was a 17-year-old girl. And I was so proud of her that she, because most of the time, as I mentioned, I'm sort of doing this on the side, and it does impose on my family's life. In fact, even now, I had to go and tell the kids to be quiet because we're speaking and recording. But it really was something that her message to me really hit home. It really resonated with me because she was absolutely 100% true. It's what I've set out to do, and like you, it's part of it is work, and part of it is just the meaning and purpose of our lives.
Absolutely. What a special moment. And thanks for sharing that. And it's sometimes, kids will surprise you in very unexpected ways. And sometimes things they say are so profound and meaningful, and they might not even realize it when they say something like that.
Yeah, so true.
So, along that theme of profound and meaningful, as you're thinking about posting your 135th episode, are there any episodes? I'm sure so many of them have really, you feel, made an impact and spoken to you, but are there any that come to mind that maybe in some of the more recent episodes where you say, boy, this is really something that moved me and caused me to think about something differently?
Yeah, there are, Brian, I'm sure you can relate to this. It seems to me every episode, I would say almost every single episode I've posted or recorded, and I've probably recorded well over 250 and posted a little bit more than half of them. Each one is astounding and awesome and really kind of makes me think differently. But the ones, of course, I think about the most are the most recent ones. There are two issues, and I'll start with one that has really gripped me. And in fact, as I began to understand it or notice it, I've now been seeing this theme emerge in lots of the interviews I'm conducting. And I guess I would label it in a couple of ways. You could call it whole person healthcare, person-centered care, and another name that I've just been recently introduced to is contextualized care. So, in fact, the episode I'm posting tomorrow, or this Wednesday rather, in a couple of days in June, I was introduced to a company called Laguna Health, and the CEO, whom I actually interviewed a few months ago, talked to me about a home-based care ecosystem again, and that is another theme, the shift of care from brick and mortars to the home. That's a huge movement I'm seeing. And embedded in his approach, though, was something that really gripped me. And he said, when I asked him about who his command center was composed of, he said, mostly people who are non-clinical. There's social workers and health coaches and psychologists. And I asked him why. And he said, well, we've been working with some scientists who have really been studying clinical encounters for decades. And what they've discerned is that the vast majority of issues are really not the issues that get patients into trouble are not fundamentally clinical. They're actually what they are calling contextual. So they're issues of access, transportation, navigating the system, being able to deal with other competing responsibilities, and on, financial issues, social support issues, loneliness, isolation. They do cross over into what we now call the social determinants of health, but they're even more specific and more immediate and more proximal than some of these larger social determinants of health, like education or things like that. They're really the factors in people's lives. And these scientists have literally been studying this for decades, created 12 domains of contextualized care, and have really, it is a science. And what this company is doing is just blew me away, is that they're taking the science and literally embedding it into their entire process, into their technology, into their training, who they hire, how they're engaging with patients, so that literally day by day, they're reviewing these contextual barriers to care, the things that get people into trouble. It really changed my thinking about the whole home-based care ecosystem. And in fact, most of us think about remote patient monitoring, and we're thinking, we're going to monitor someone's oxygen, or we're going to monitor their glucose, their blood pressure, temperature, which again, basic vital signs, basic physiologic monitors, and there are many, many more than those few. But what I'm beginning to realize is that we need to start to monitor other facets of people's lives, and there are ways to automate that. This company was talking about the fact that emotionality. Again, think about this: someone gets discharged from the hospital, and most people, if you ask them, well, what would you need to monitor? Again, typical sort of physiologic monitors. But what about someone's emotionality? The fact that they've just been in a hospital, they have been terribly sick, with something that could potentially be life-threatening. They've had some procedure done, probably many procedures done. And of course, as good as hospitals are, we know how disorienting and debilitating a hospital episode is. And then they get transported back home, and they've got to kind of figure it all out on their own. And that whole sense that just their emotional state, okay, that has such a huge impact on every aspect of their healthcare, that in and of itself really blew me away, that they had really blown that up and understood that and taxonomized that and embedded it in their processes and workflow. I think there is so much to learn from that. It's a complete reframe of post-discharge care, but I think healthcare in general. And I think, I'm hopeful, and I believe that care in the future will be much, much more contextual, much more personalized. Another case of that, or example, and again, I've begun to see this in numerous interviews. I was interviewing Dr. Ben Kligler from the VA system, and he is in charge at the national level of what they're calling their whole health or whole person care. And this is a national initiative, and literally deploying across all the sites. I think there's 140 large healthcare sites in the VA system, plus thousands of other clinical centers. And what this is about is embedding into every clinical encounter the notion that I'm not just going to ask you what's the matter with you, but I'm going to ask you the question, what matters to you? And whether that is something to do with your relational life, your spiritual life, exercise, issues you're struggling with around finances or drug dependency, whatever the issue is that matters to you at this moment in time, if we don't address that, how are you going to be able to actually deal with your healthcare? And it's really a different way of thinking about healthcare within the context of an individual's life, and really bringing life and healthcare together. And when you stop to think about it, what it made me realize is how decontextualized our current healthcare system is. And by the way, Brian, you know this because you listen to the podcast. I am never critiquing the people in healthcare, the physicians, nurses, PAs, staff, techs, providers, administrators. It is not about the individuals, because I believe that they are just incredible, and full of passion and full of professionalism and expertise, and they give their lives to this work. It's not about the people. It is about the system. And I, again, I trained in process improvement and Toyota production system. It is always about the system. We have to change the system. It's rarely about the people. If you have the system right, you can, the people will do the right thing. And I think that we need to shift from this decontextualized system that has evolved over the past few decades into one that is more contextual. And that includes this whole person health movement. It includes the social determinants of health. It includes the disparities of care. But it really is about treating each and every individual as a person who has a life, and health and healthcare are part of that life, and really bringing that together.
That's so powerful. And it actually ties in very nicely with what your daughter was saying, where, healthcare is still broken. And it's interesting because, we've been at this for a while. And when you look at how long it's been broken for, it's been broken, for quite some time. And at least from what I can see, it hasn't necessarily gotten better. It's gotten worse. And I think you've done a nice job of articulating it, even though the actual healthcare has gotten better. So the pieces in the hospital when someone is acutely ill, and fully agree with you, by the way. And I know as well from the podcast, our colleagues, and I'm including in that the broader clinical colleagues, nurses, anyone who's involved in patient care, everyone is deeply passionate. Everyone cares a lot. Everyone is doing the best that they can, truly doing the best that they can for every patient. And what you realize is the way the system is set up. And I think fundamentally too, part of this has to do with payment, that when you set things up on a fee for service basis, then all the systems are set up and oriented around delivering that individual service, and whether the outcome of the service doesn't impact your payment for that service. And it's not always, I shudder to kind of think about, and I don't believe anyone is intentionally, even though I know there's these rare bad actors, by and large, no one's doing anything inappropriate. No one is thinking that way. Everyone's focused on that individual patient, but they're missing the context. They're missing, here are the larger things that really will make a difference in the patient's outcome. Love to hear a little bit more about your point of view. How do you feel about the payment system and how the payment system is changing, and how is that going to support, this more contextualized care?
Well, I'll start out by saying that in all of the interviews I've conducted over the past 6 or so years, and I actually started the interviews prior to the podcast as part of the research for the book on reframing healthcare that was published in 2019. In all of the interviews, literally the 250 or so, there has never been, not one interviewee has supported the fee-for-service payment model. And that in and of itself is telling. And I do ask that question either, during the interview or before or after the interview. And the vast majority of them are either trying to figure out how to get around the fee-for-service system or how to change it. I was just thinking about Vivian Lee, who is just a phenomenal physician, researcher, educator, entrepreneur, technologist, brilliant person. She wrote a book, and in her book and both in the interview, she was absolutely clear as and I completely align with this. the fee-for-service model has, to my mind, I won't speak for Dr. Lee, but to my mind, it has decimated our healthcare system. It has. I'm a primary care physician. I practiced for over 20 years as an internal medicine doctor in New York City and in Boston. And I will tell you that the fee-for-service model is so antithetical to the profession of primary care, and I would say to specialties as well. And I think it's one of the reasons we're seeing less and less people go into primary care. I mean, when you go into a field because you want to spend time with people, and like you were saying, I think the vast majority of clinicians, providers, staff, technologists, they go into it for a reason. Particularly primary care physicians and providers, they go into it because they actually want to spend time with people, talking with people about the context of their lives. And then they're thrown into a system where you have 10 to 12 minutes to talk to a patient. You've got a checklist of things you've got to, cover. You've got an electronic medical record. We know, and again, it is what it is, but we know the facts are, we know how many hours a day and a week providers spend, just recording visits, the documentation and coding. And there's no question that really takes away from the time, energy, attention that they should be spending, really understanding people and their lives and contextualizing healthcare for people. So I absolutely, I am certain that it is one of the, before we do anything else, people talk about, and in fact, that conversation I had with Dr. Lee, she said, people talk about Medicare for all. If we have Medicare for all, but we continue with a fee-for-service system, Medicare would be bankrupt in a month. The first thing we need to do is really shift to a system of payment that actually pays for value, that actually pays for outcomes, that pays for what doctors and nurses and others really went into healthcare to do.
Absolutely.
I didn't beat around the bush. That's I mean,
I appreciate that that's, I think that a lot of people passionately agree with that. And you highlighted something I'd like to go a little bit deeper on, which is the EMR and really the technology supporting payment systems as well as delivery systems. One thing that I've observed is certainly, I think it's way better to have digital versus paper records. I think everyone agrees with that. However, one thing that's really interesting is if you look in other industries, when they've digitized, they've done it in a way that has ultimately benefited the consumer. Where if you look at our digitization efforts, while you can argue consumers certainly do get and patients do get some benefit because now you can access information. At the same time, though, we're probably the only industry I could think of where you have a transaction system, that everyone is doing their documentation and work in. And just to kind of a compare contrast, I know you've spoken to lots of organizations that are doing more advanced care models. And one of the things that I've observed that anytime anyone's doing a more advanced care or payment model, their core system isn't the EMR. They're building their own technology stack. And there certainly has to be an EMR for a variety of reasons as a piece of that, but they're not using that as the login and workflow tool. However, when you look at healthcare and hospital systems, I don't know of a hospital system that doesn't use their EMR as their login screen. So would love to hear some of your, thoughts, reactions to that.
Yeah. So let me just start by saying two things. First, I'm not a technologist. And so, I'm not an expert on EHRs. And secondly, I would say that, again, this is not a knock on the folks who work on electronic medical records, informatics, and analytics. I will say I work very, very closely with my colleagues and have tremendous respect for what they are doing and what they're trying to do. And I would say, I think the legacy systems are trying to create more contextual care, even the notion of embedding questions on social determinants of health. So I think everyone sort of understands it now and is trying to move in that direction. But to your point, one of the observations I've made is a lot of these new startups, and whether it's I've been spending a lot of time over the past 2 or so years focused on senior care, and whether you're talking about Chen Med or Iora, two classic examples. they created their own electronic medical record system because they felt the current legacy systems were inadequate. And you're seeing others as well who are in that sort of Medicare Advantage world, all creating, I would say, to your point and to the point we've been discussing, an electronic medical record system that actually encourages and promotes contextualized, personalized, customized care, as opposed to making it more difficult to do that. And again, you can't actually, and the one thing I'm really, really careful about, and I've learned as I've been doing this, is I don't point fingers at anyone. It is not just the technology. It is the entire system of care. And to the point we were just making, fundamentally, it is about the payment system. It always goes back to the payment. It always goes back to the money. And I think we have to change that. And I do want to say that, just to say something about this point, where we started out with the notion of the system, we can do lots of process improvement. We could do lots of incremental change. It's important. We've got to get more efficient. We've got to constantly strive to get errors down to zero. So, big believer, big fan of that. Spent years of my life in that domain. And at the same time, the pattern I've noticed with emerging startups and approaches is that they are coming at this from a new orientation. Right? They're coming at it. And some of these are legacy systems. Who would have thought that the VA would completely reframe healthcare with this notion of contextual care? And yet that's what they're doing. So it doesn't have to be a startup doing this work, which actually, to me, is incredibly inspiring and incredibly hopeful. And I think it's a message that all of us should take home to our organizations, that we can reframe healthcare. We can reorient our thinking and do something radically new. And again, part of this, and it's really interesting because part of what the VA, the advantage they have actually, which came out in the interview I conducted with Dr. Kligler, the advantage they have is, interestingly enough, is that they don't work on a fee-for-service basis, right? And so again, it just like we were saying a moment ago, it all comes back to payment. I think for me, that is one of the resounding messages. I had a mentor who, when I was writing my book, he reviewed the book and on reframing healthcare, and I talk about the basically that pattern of what I call the reframe roadmap that I'd seen entrepreneurs and CEOs and founders over and over again repeat the same sort of pattern of reorienting and redesigning and reorganizing healthcare. And his one comment to me said, I really enjoyed the book, but one thing I really would have liked to have read more about was the money, because it's always about the money. And so that's just, I think as I'm learning about it, and what's interesting about that is that I'm actually speaking at the HFMA annual symposium later this month. And I have to tell you, I can't tell you how excited I am to be speaking to 2 or 2,500 or 3,000 finance folks, because I've come to realize that finance is absolutely critical. We've got to change our business models, and the financial folks are at the heart of that. And again, you can't, I would never point fingers at anyone, whether it's finance or the technology colleagues, or that's just not the point. The point is the system, as we were saying a moment ago, and how do we all rally around what we know we need to do, which is fundamentally change the payment model.
Absolutely. Couldn't agree with you more. And also I think that the point you're making, there's no, none of our colleagues, no matter what side, on the business or on the clinical administrative side, everyone's truly are doing their best and trying to do the right thing for patients. At least that's what I observe. Yeah. And at times it's so challenging because you do get put into a place where the way that things are currently designed, they at times, not only don't support, but inhibit doing the right thing. Classic example, boy, I'd love to be able to give this person transportation. However, that's a kickback. And right. Obviously, CMS is acutely aware of this. They've made incredible progress on programs, want to get people into value-based care programs, setting up appropriate waivers. Right. So there is a lot of work that I think is very positive. That being said, we're in the middle of this, and it's been going on for quite some time. And it almost appears like we're admiring the problem, and not a lot of progress is being made. But at the same time, I reflect and say, you know what, sometimes change just does take, it's a multi-decade process before you can actually see the results.
Yeah. It's, I completely track, and resonate with everything you just said. This is what they call the dialectic, right? The greatest level of maturity is being able to hold two opposing thoughts at the same time. Reid Hoffman used that term. The guru from California. He said about his industry, which is tech. He said he's constantly in frustrated awe. And I have to tell you, I've lived the past few years of my life in frustrated awe of healthcare. It is so awesome. The people are awesome. The technology is awesome. The science is awesome. What happens every day is awesome. And at the same exact time, it is the most depressing, frustrating, industry. And both of those statements are absolutely true. And our ability to actually hold that tension, and in the face of that, have the hope and vision and resilience, and the courage and the persistence to continue. I actually think that is to your point a moment ago, we are living in this each and every day. And how do you motivate yourself to come to work each day? How do you motivate yourself to continue to do this in that state of the dialectic? It is our life. It is it is, as Dickens said, is the best of times and the worst of times.
Absolutely. And one thing that I'd love to hear about from your point of view is that you're in this very unique situation where you're doing these amazing podcasts with all of these innovative, interesting people, hearing all of these ideas that truly are transformative ideas, and not just ideas, but people that are doing it, actually making these things happen. And at the same time, you have a day job at a, very progressive, but a healthcare system. And your colleagues at that system oftentimes probably don't have the advantage of hearing all of the different ideas and perspectives that you do. So I'd love to hear a little bit more about, how do you take all these amazing things that could help patients and then translate that into the reality of your day job at a healthcare system?
Yeah. So I think one way to tell the story of the podcast and the book was I needed a lifeline, right? I needed a line to people who, to your point, these are not people who are academics. They're not talking about some future state. They're telling us what they're actually doing, what they are accomplishing and continue to accomplish. And I think that's, to me, that was sort of the key. A lot of people call me up and say, I'd love to be on your podcast. And they ask, what's the criteria? And the criteria is that you're actually, creating a new healthcare system. It's that simple, and not talking about it, but doing it. And so what's really interesting, to borrow another sort of metaphor, from that old show Seinfeld, if you remember that sitcom. They talked about worlds colliding. And I think one of the most magical things for me is somehow my avocation of podcasting and talking to folks outside has literally now collided with my day job. So I get the opportunity, which to me is just, again, magical, to bring a lot of these outside thoughts. I mean, that's become a good part of my job, is to really share with my colleagues what's happening, and quite honestly, to reflect on and appreciate what's happening inside the organization that's transformative. And so I do both. I literally, when I'm speaking to my colleagues in my day-to-day meetings, it often feels to me like I'm interviewing someone on the podcast. It's that awesome in terms of some of the changes we're making. And so I feel like my job in the organization is really to emphasize, promote, encourage, support, catalyze some of the amazing transformational changes that are happening inside, and also continue to look outside and bring those ideas in, either to, a lot of ideas that you bring outside are already inside the organization, but this provides a little bit more encouragement, an example. Hey, it's happening here. We could learn something from them. And so my worlds are colliding, and I couldn't be any happier about it. At the same time, all of us in healthcare, as you were saying a moment ago, we have to deal with the current reality as it is. And you got to keep the business going, and patients are coming in. And so I think it's a both and. And like I said before, I've just tremendous respect. I don't know if you know this, Brian, my wife's a practicing physician. She's an infectious disease doctor. So she's been incredibly busy for the last couple of years with a small thing called COVID-19. And I mean, she just works round the clock. And, again, I look at her, I look at my other colleagues, and I can't believe, their resilience, their passion, what they've done to save lives across the country and across the world. So again, transformation's critically important. And at the same time, the work that happens every single day is critically important as well.
Absolutely. And I do remember that piece from our encounters years and years ago, the double physician family. Maybe one last question, and also certainly agree with you that's been great that the worlds are colliding in a way that Seinfeld didn't anticipate, where it's actually creating some mutual benefit.
Right.
And part of that, I think, probably has to do with you and your ability to communicate and message. So you're bringing these things in a very, constructive, productive way that makes people feel good and enables them to see the pathways forward. So along those lines of thinking about and seeing the pathways forward, last question for you is, you think about what's going to unfold. Obviously, none of us know specifically, but I know this is something that you give a lot of thought to. What do you see happening, with healthcare in the near term and long term? What are the different moves and gyrations that we're going to have?
So, I mean, I think there are certain forces that are present and catalysts that are present that are going to change things, and we're going to have to deal with them. I think one is clearly global warming, and I've learned that from some of the interviews I've conducted. But the World Health Organization has declared that global warming is the number one issue that's going to affect health worldwide in ways that actually shock me. When you start to think of areas across the globe where there's going to be food shortages and water shortages, and people literally emigrating to other parts of the world. I mean, movements like that will make anything that has happened before, seem minor. And so I think that's just something we haven't really explored and understood enough. And I know my organization's committed to it and beginning to work on it as other healthcare systems are. One stat around that is that the global healthcare system, so healthcare across the globe, if it were a country, it would be the 5th largest producer of CO2. Emissions. So one of the things that is happening we can do is reduce CO2 emissions within healthcare delivery. And I know that's a big movement. The National Academy of Medicine is very focused on that as well. So I think that's something that, it may seem like it's coming out of nowhere, but it is a reality that we're going to have to deal with. Another one is what people call the silver tsunami. The demographic changes in this country and across the globe, again, unprecedented. So this is really somewhat, similar to global warming in that this is a change that there's nothing that we can do anything about. It is happening, and it's going to happen, and we have to recognize the enormity of it, and we have to figure out what our response is going to be. Some stats, just to understand, there are somewhere between 50 or 60 million seniors in the next 2 or 3 years. By 2040, I think there are going to be nearly 100 million seniors in this country. In 10 years, there are going to be more people over 65 than there are people under 18 years old. That demographic shift has never, ever happened before. And that's not going to be a blip. That's going to last for decades to come. The 85-year-old and plus is the fastest growing demographic. If you look at those graphs, they're shocking. And so we know that people over 65, 75, 85 consume tremendous amounts of healthcare. And we have to figure out some way to manage that in a much better way than we have now. Again, almost goes back to what we were talking about before. If we continue with a fee-for-service system, that won't be sustainable for any amount of time. And so these changes that you and I have been talking about they're going to be force functioned by issues that are out of our control. What we can control is our response to it, the awareness of it, and responding to it. I think another major issue is the whole issue of disparities of healthcare. Spent quite a bit of time talking to Don Berwick and Micheline Davis and others about this. It's shocking, right? And you know these stats. For instance, looking at maternal fetal mortality between Black women and white women in our country, it's unconscionable. It's not even, I don't even know where to begin to talk about it, the ethics of that. And it's not just that, it's, you look across the board. And again, at this moment in time, you know, with those facts staring us in the face. And by the way, to your point, it doesn't appear that they're getting better. And so they're not going to get better on their own. I think the worsening financial situation for Americans across the country at this moment in time, the vast majority of Americans, one hospitalization, one major illness will put them into bankruptcy. Literally, that's not a minority. That is the majority of Americans cannot sustain a hospitalization or a major illness. So again, these are factors which are real and which are getting worse, and which again, I don't say this in a way to create fear or anything else other than to say they're real. We need to be mindful. We need to be aware, and we need to collectively do something about it. I'll end with this, and I interviewed Don Berwick a month or two ago, and he had a quote which it has stuck in my head. I can't get it out of my brain, and I think it's so true. I also think it's a message. And he said, you know, Zev, the status quo has tons of lobbyists. The future has very few. And what I would say, what I heard in that message from myself, and I would say to others is, are we going to be lobbyists for the status quo? Are we going to be lobbyists for a better future? And the question is that simple. And there is no in between. You're either for a better future or you're a lobbyist for the status quo. And maybe I'll just end with that.
Really, really appreciate all of your thoughts and perspectives, and couldn't agree with you more. You know, the one thing that always resonates with me is your number one predictor of life expectancy is the zip code you live in. And if you look at how life expectancy has changed from an economic point of view over the past century, it's not moving in the right direction. And you know, these disparities are just getting wider. But at the same time, though, something that you've highlighted that you know gives me a lot of hope is there are so many people that are passionate about really doing the right thing and really making the change. And it's just about getting enough of us together with the right circumstances. And it's and all the people that you've spoken to, it's almost the analogy I think was like a brick by brick. We're kind of building this new structure, this new thing, and each person's doing their part. And although it might seem like things are not happening and not changing, each person is doing something. And eventually we'll get enough that's there that there will be a systemic change.
And I think that's why we're talking today. It's, you know, why you do what you do and why I do what I do. It's just, in some sense, it really is a bit of community organizing, right?
Mm-hmm. Absolutely. And really, it's amazing to me the outlet that you found with that notion of community organizing and making a difference. And as your daughter said, you can't really stop because healthcare is still broken, which I paused on that. I'm like, wow, that's really inspirational. And then on the other hand, I'm like, you're going to be at this for quite some time then. But not that I'm not hopeful for the future, but just realizing
right.
that it's going to take some time before we get there. But certainly I think what you're doing and your contributions are making a significant impact, and really appreciate you sharing all of your stories with us today.
Yeah, it's my pleasure. And, Clay Christensen wrote a small book about how do you measure your life. And I think, Brian, the hopeful thing is that I can, and I suspect you feel the same way. I can't imagine doing anything else that is more meaningful and purposeful than this. And I think that in and of itself is hopeful to be, and to your point, to be part of a community and to be working with amazing colleagues all the time and to be inspired by them and frustrated by them but to be working to really align around helping people. It's just, I don't know, at the end of the day, I think it is just the right thing to do. So meaningful, so purposeful, so important, so rewarding.
Absolutely. I think that all of us witness firsthand the challenges they're facing, either delivering care or getting care. And that's a great motivator to say, we've got to figure out a way to do it better. And it does feel very meaningful to be part of that solution.
Yeah. Amen.
So thank you so much for joining us today. Again, just really appreciate it, and turn it back to Steve.
Our thanks to special guests, Dr. Zev Neuwirth and Dr. Brian Silverstein, for their time and discussion today. And for our listeners, don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned to the Innovation Accelerator podcast for more shows covering the healthcare IT topics that you care about. For more information on this and other healthcare IT topics, please visit innovator.com. I'm Steve Ambrose, wishing you a great day.
You've been listening to the Innovation Accelerator podcast, brought to you by Innovator, the health cloud company. Don't forget to check the show notes for links to related resources and other information. And stay tuned to the Innovation Accelerator podcast for more programs about the healthcare IT topics you care about. Accelerate your transformation and build the future of health on the Innovator Health Cloud. For more information, please visit innovator.com.